Welcome to the Family Medicine Clerkship. This is a brief orientation to the clerkship. All of the information can be found in the syllabus and on the Blackboard site. Specific schedules will be communicated to you during your orientation with the clerkship director, the on-site orientation, or on the first day of your clerkship. This clerkship is designed to introduce you to family medicine, the primary care specialty, and provide you with an opportunity to care for patients in the ambulatory setting. You will provide supervised medical care to patients with a broad range of conditions in the context of family and community. Family physicians care for patients across the lifespan in a variety of settings, so some of your day-to-day experiences may vary. The overall learning opportunities will be similar, and there will be a focus on prevention. Some of you may have additional opportunities to see patients in the inpatient setting, skilled nursing facilities, hospice, home visits, sporting events, and clinics designed to care for those without adequate medical insurance. This will be a robust and broad experience in direct patient care. You are required to record at least 100 patient encounters in the ambulatory setting, with 80% at the full level of participation, although I encourage you to record all patients and not just the minimum required. There are 30 required conditions that must be documented. All are common conditions seen in the ambulatory setting by a family physician. There are 20 required healthcare screenings that must also be documented. These are all evidence-based, with recommendations from the United States Preventive Services Task Force. You will use eValue to log all of your encounters. If you have any questions about any of the patient encounter requirements, please contact your clerkship director or me for clarification. There are 2 assignments for the family medicine clerkship. The first assignment is the personal educational goals. You will choose 3 educational goals specific to your own current learning needs that are not a requirement of the clerkship. They can be a specific skill, knowledge in a particular content area, or a behavior you wish to modify. You will then develop a strategy to achieve each goal during the 6-week clerkship, identifying appropriate resources and targets by which you can measure your own progress. Discuss your educational goals with your clerkship director and your clerkship faculty, and be sure to submit this to both of them by the end of the first week of the clerkship. Your clerkship director will provide feedback about your goals and the strategies you develop to meet them. During the rotation, you will track your progress and then write a final report that is submitted to me through Blackboard before the end of the clerkship. The second assignment is the systems project. The purpose of this assignment is to highlight the systems of patient care and how they can impact access to care, financial burden, adherence, and coordination of care. You may choose one of 2 options, the referral project or the cost of chronic care project. The referral project is designed to demonstrate the interprofessional teamwork and collaboration between healthcare professionals in the care of the patient, and to emphasize the potential for system errors when care is not delivered continuously. The cost of chronic care project is designed to highlight the financial impact to patients based on our recommendations, and to demonstrate the importance of evidence-based guidelines in the clinical care of patients as related to management of chronic conditions. Specific instructions for each of these options is available in the syllabus and on Blackboard. All assignments will be evaluated and become part of your final grade. Grading rubrics and additional details are available on Blackboard. If you have difficulty posting to Blackboard, please contact Deborah Lee Lesueur for assistance. In place of a required textbook, we are using FM cases in the family medicine clerkship. There are 40 cases on a variety of topics, and each takes approximately 30 to 60 minutes to complete. Please try to complete these in the first 4 weeks of the clerkship so that you have ample time to study for the NBME during the latter part of the clerkship. For students in Mariana that are participating in the longitudinal integrated clerkship, you should complete the 40 cases by winter break so that you can start studying when you return for spring semester. The regional campus clerkship directors may have a specific order or other instructions for each of the cases. FM cases can be accessed at the MedU website using your FSU.com email account as the username. In addition to orientation, you will meet with your clerkship director every week during the 6-week rotation. If you are in Immokalee, this meeting will be arranged through video conference or teleconference. During these meetings, you will discuss the FM cases, patient presentations, review progress on required components of the clerkship, and sample test questions. One of the weekly educational meetings will be devoted to the pharmacy field trip, during which you will review common over-the-counter medications taken by patients and compare the options they are confronted with when choosing a remedy. At least once during the 6-week clerkship, and possibly twice, your clerkship director will directly observe your clinical skills during one or more patient encounters. This may occur in the office of your clinical faculty or in the office of your clerkship director. You should self-evaluate your progress several times during the clerkship. I created a self-assessment worksheet for you that is posted to Blackboard. On that, you can take notes on your own progress in achieving the clerkship competencies and use that as a springboard for a conversation with your clerkship faculty and clerkship director about your progress with development of important clinical skills. On the last day of the clerkship, you will take the NBME Family Medicine Subject Exam. This includes the 80-question core plus an additional module on chronic conditions. There are materials for exam prep posted to Blackboard and a practice exam available through FM Cases. More details on all of the items discussed in this orientation are available in the syllabus and Blackboard. You can also email your clerkship director or me with any questions or concerns. Enjoy your family medicine clerkship.